affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Yes, that's my bell. Welcome, welcome, welcome. Late night, all county, You and Your Doctor show. And we wanted to celebrate You and Your Doctor. Unfortunately, I couldn't get somebody here, so Dawn jumped in here with me. Louise is in New York, but we wanted to take a moment to congratulate. Is that right? Congratulate.
You know what I love about radio is they can't see my expression.
I'm going to tell you something. I am exhausted, but we wanted to say thank you and congratulations to.
Let's try it this way. Congratulations to All County Healthcare for 1,000
radio hours.
Thank you.
On the air with me. They've been with me close to almost 6 years. And the amazing aspect is they've brought in tons of doctors. We've done tons of stuff with them. We wanted to take this moment to share this with the radio station, with you, the listeners out there, to learn and hear. We're going to put the greatest, we're going to put some tapes together to show some of the shows. And they're telling me to wrap up, so we got to go.
Wrap it up because he's rambling. For all your all-county needs, all your health care, home aid, respiratory therapy, and medical nursing needs, contact All County Healthcare. Goes to the Tri-County area. And take a listen. These are the best ofs.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home health care agency. We are servicing Miami-Dade, Broward, and Palm Beach County. You can reach us directly at 954-717-7027. I am your host, Louise Gomez, and today I would like to welcome to the show Dr. Gil Lichtshein.
Yes.
Did I say that good? Okay, I'm calling
Close enough.
I'm calling you Dr. Gil from now on. And he is an adult and child psychiatrist. The phone number you can reach him at is 561-300-4052. And he's right here local, 7100 West Camino Real, Suite 404, right here in Boca, 33433. Welcome to the show.
Thank you very much for having me.
Absolutely, absolutely. I always like to learn what's going on and what's new and exciting in the field that you're in. But tell us a little bit more about you and your background. And I always love to ask, when did you realize you wanted to delve into your industry that you're in now, psychiatrist?
Well, that's a great question, because I one of the many hats that I wear is I teach at FAU's College of Medicine, first year med students, and so
nice.
I a lot of times will ask them, like, so I know you just started med school. Do you have any idea what you want to go into? Some already know. Some are kind of figuring it out or thinking or not sure. So, I tell them, like, yeah, kind of. I was in the same boat, that when I first went into med school, I kind of knew what I didn't want to do.
Okay.
So I knew that OBGYN I had no interest in,
Sure.
and general surgery I had no interest. I would say, I remember when I was a young kid, I had severe nearsightedness, so I'd always go to the eye doctor, so I always had an interest, maybe I'd be an ophthalmologist. Then I had perhaps some interest in anesthesiology, but then what got my interest in psychiatry was a few things. One, I remember as a first year med student, there was a behavioral science course. I was at the University of Illinois College of Medicine, and it was the preceptor, I still remember, Hyman Muslin, who was a Jewish psychiatrist. He was in the School of Self-Psychiatry, Heinz Kohut, but he had such a way with him and how he kind of talked about mental health and psychiatry that got me, interested. even still to this day, the brain is still kind of the most enigmatic organ in our body. I mean, we know everything about our heart, the lungs, the liver, the kidneys, but yet the brain, we're still learning about the different circuits in the brain and different functions of what this part of the brain does and what that part of the brain does.
It's fascinating to me. It really is.
We're still learning, and we're still, trying to understand.
Right. So I find it so fascinating. You get to treat children all the way up to adults. Is that right?
Correct. Yes.
Nice. And there's so many new modalities, right? And there's so many different things that are always changing and updating. I think you do a couple of things that are a little outside the box and different as far as treatments. You do the ketamine and then the TSM?
TMS, correct.
TMS, I'm sorry.
I mean, you're talking about like new modalities, new treatments. That kind of goes into what I was saying about how we're still learning about the brain. And for example, just in the past, I'm going to say earlier this year, a new drug came out to treat schizophrenia.
Really?
That completely just different from the standard antipsychotics that have been used for decades. I remember when I was in medical school, the idea of schizophrenia, the dopamine hypothesis, there's too much dopamine in the certain circuits of the brain that cause the symptoms. That's not really what we're learning. Is like that's partially true, but like this new drug that came out I'm going to say like in the spring, it doesn't even target the dopamine system, but has been shown to be very effective. And I don't treat many patients with schizophrenia in my practice, but I do cover on Sundays I cover an adult inpatient unit at Fort Lauderdale Hospital, and so I have a lot of patients there with schizophrenia, and so I've been using this new medicine. It's called Cobenfy, and I've been prescribing it a lot to these patients, and I've seen it do like amazing things. So it's just a new understanding of schizophrenia.
Good. Yeah.
You're talking about ketamine and TMS. So ketamine, which is a dissociative drug that it's a party drug. People like to take it so they can dissociate and have these out-of-body experiences. But ketamine has been used as an anesthetic for 50 plus years.
Okay.
It's used a lot in kids as an anesthetic. It's safe.
Oh. Okay.
And really does a great job. But there's a lot of literature also that has shown over probably at least 20 years that ketamine has rapid antidepressant effects.
Okay. Nice.
And it targets. So again, depression, the whole idea, depression is, it's too little serotonin.
Yeah.
I have a patient, it's a chemical imbalance. And it's much more complicated than simply too little serotonin or too much of this. But ketamine, if you're gonna look at it from a chemical perspective, ketamine targets a totally different neurochemical called glutamate.
Okay.
Again, showing that, depression involves multiple neurotransmitter systems. It's not just simply too little this or too much, too little serotonin. It really involves a whole multitude of different neurotransmitters. So ketamine, which is in a nasal spray, is FDA approved to treat what's called treatment-resistant depression. Patients who
can they just self?
So no, it's an office-based procedure. Just because ketamine can cause changes in blood pressure and pulse, and if you have this out-of-body experience, you got to be monitored.
Okay.
So it's really an office-based procedure, but it's safe. It's also much more rapid acting than your traditional antidepressants.
So you give them therapy while they are.
So
how does that work?
So again, ketamine being, I'll use the term loosely, a psychedelic drug.
Okay.
Again, I'm using that word loosely, but so there is some rationale of also, and a few of my patients who I administer ketamine will then, I'll coordinate with their therapist that they go to their either the therapist will come to my office, or if the couple patients that I coordinate this, the therapist is in the same building,
Okay.
I'll walk them to their therapist's office and they'll sit there for several hours and undergo therapy while they're under the influence of the ketamine. So ketamine is really kind of more for people with more treatment-resistant depression or depression with acute suicidal ideation.
Oh, wow, okay.
Now, if I had a patient who says, like, I don't want to take Prozac, I don't want to take Lexapro, I want to do ketamine.
Okay.
I'd be like, okay. I mean, I wouldn't have a problem. I would just say to them, like, if you're looking for your insurance to cover it, they probably won't, because it's not indicated as like a first-line treatment. But
Got it.
if a patient's like, you know,
Yeah.
screw my insurance, I'll just pay whatever it costs.
right.
Like, money's no object. I want to do ketamine. I'm not going to deny them
Sure.
that treatment. The same thing with TMS, which is a totally non-pharmacological treatment. So it's a device that consists of an MRI strength magnetic coil that you place in a particular area of your head, and it delivers these repetitive pulses, magnetic pulses that
Do they feel that, or?
kind of feels like a woodpecker pecking on your head.
Okay.
And it penetrates about 1 inch into underlying cortical structures, and because the brain, like the heart, is an electrical organ, that the nerve cells communicate with each other through electrical impulses. There's a law in chemistry called Faraday's law.
We have a quick commercial break. I want to continue. This is good. We'll be right back, everybody.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome to the show, Dr. Santaloy.
Thank you, Louise. Thank you. I am so glad to be here.
We're so excited to have you. I know I had a little pre-conversation with you. I know we have a lot of great stuff to share.
Yes, we do.
Yes. So, Doctor, I usually like to find out a little bit more about your background. What made you want to get into this interesting field of medicine, and what was that like for you?
So I started as a regular RN. I've been a nurse practitioner for over 20 years, and I got my doctoral degree in nursing in 2016. I started initially just in internal medicine. I have a background in internal medicine and geriatric medicine. Initially, when I started practicing, I was seeing patients in the nursing homes, in the assisted living facility.
Oh, wow.
Because I love my older people.
Nice.
But going through it, and also I was seeing patients in the office.
Okay.
But the one thing that I did notice is, number one, by the time somebody gets older, they are so debilitated and are on so many medications. So I started wondering, what can we do in order to prevent that from happening? And besides, also in my office, I've had patients come in, you know, where they will come in and their labs are quote unquote okay,
Right.
but they felt terrible.
Yeah.
You know,
That's very common, right?
it is. And they were coming out like defeated. And I'm like, there has to be an answer to this. So that started my journey into the world of functional medicine.
I love it.
So now I integrate not only internal medicine and primary care, but also functional medicine, so that I can address people's illnesses and issues from a root cause instead of just throwing a medication at it.
Yeah,
You know, and our health is our wealth.
absolutely.
So, and also prevention is huge for me. So that's how I started my journey. And now I'm on that path of integrative medicine, where we approach everything from a holistic standpoint and also personalized.
Tell us a little bit more about women that may be listening right now, and what are some of the symptoms, and maybe what are some of the devices or modalities that you have to help them with that.
Yes, and that is a topic that most women are very embarrassed to talk about.
Yeah.
And any woman who's had a child knows what it does on their pelvic floor and on their bladder.
Yes.
And sometimes we take it, oh, it's normal, you know, if you cough or you sneeze or you laugh too hard, you lick a little bit of urine. It's like, oops, you know, it's normal, but it's not. It's all because of a weakness in the pelvic floor.
Yes.
Now, think about regaining your confidence again when you don't have to worry about wearing a pad, when you don't have to cross your legs because you're going to have to laugh too hard,
Yes.
or you're coughing, where you can actually be relieved of that. So the modality that we have is the MCLI. It's basically a chair
Okay.
that also is the same technology that causes supracontractions of the pelvic floor muscle and re-educates the muscle in order to reverse urinary incontinence, not only in women, but also in men as well.
Good to know.
Like men who've had prostate surgery,
Sure.
you know, who've had radiation to the area, also can benefit from that modality because it helps with the incontinence. And with that, you know, imagine one session is the equivalent of 12,000 Kegels. Now, can you do a Kegel?
Wow.
You know, and most of us, we don't even do a Kegel properly, let alone 12,000.
Yes.
And the beauty of it is you sit fully clothed. There's nothing invasive, as if you're sitting for 30 minutes doing your crossword puzzle, watching TV, you know, or reading a book while you're treating your pelvic floor therapy.
Wow.
And I believe any woman who've had a child
Yeah.
should even do it in order to prevent the issues later on in life.
Oh, yes. I gave birth 3 times. I know.
Yeah.
I know. So, Dr. Sanaloy, so for patients who may not be able to come into the office, how do you work with us, all county staffing and home health, to support those patients that you have? So you have some of those.
Well, all county home health is basically our eyes and ears in the field, and it helps coordinate the care of our patients. In addition to us, we do have providers who will see patients in the home.
Oh.
So we do house calls.
I
Can you
love
believe
that. No, that's amazing.
Yes. So we do house call where we provide all the services that is rendered in the office, but to the home. So we basically bring the office to you if you are unable to get out of the house. And having such a great partnership with All County makes it that much more feasible.
Yes.
You know, where I have nurses who can monitor a patient and it's just a text or a phone call away, let me know what the patient's condition is, assist me with blood work if I need to. So I can order a lot of services, including physical therapy, nursing care, wound care, even diagnostics like x-rays, ultrasound, all that can be done in the home.
I love it.
You know, and with that, not only does it assure continuity of care, it also prevents unnecessary hospitalization.
Most importantly.
Exactly, exactly.
So this is amazing. You not only have your patients coming to you, you have the partnership with us at All County. So it's like you're taking that brush and you're just making sure everyone who needs to be seen can be seen. And this is what we're so happy to hear about. I can't believe we have 3 minutes left. A couple more questions. So
Wow.
do you have any upcoming events, health fairs, or any special programs that maybe our audience can know about you want to share?
Sure. Like on September 29th,
Okay.
we are hosting an event in the office where we'll be offering free mammogram in partnership with Boca Hospital.
Oh, okay, nice.
So we'll have the mammogram van come to the office
Okay.
where you just call the office and sign up to have your mammogram taken. During that day, it will be a whole day of wellness where you can actually demo the modalities that we have in the
I think
office.
I'll be there.
You can actually have trials of the modalities and experience it yourself. And I'll be having talks throughout the day about hormone replacement therapy.
Nice.
In both men and women, because
Yes.
we treat men as well.
Good.
You know, like testosterone therapy is also huge in our male population for the same reason that they have a decline and that can adversely impact their health. So I am inviting all of you guys to come and join us on the 29th.
Yeah, I think we're going
at the
to be there
office.
for sure.
Yeah.
So we have 1 minute left. So what's the first step someone should take if they're ready to improve their health and work with you at FEMA? What should we do?
Give us a call. You know, I'm right there for you. 954-725-7291. The first step is making that consultation.
Yes.
Because your health is your wealth.
Absolutely.
You know.
I agree with you 100%. Thank you so much for coming on to the show. It's always a pleasure to speak to doctors who
it was
really
amazing.
are proactive towards root cause medicine. So
Absolutely. It
thank
was
you.
my pleasure. Thank you so much.
Thank you so much. All right. Have a good night, everybody. We'll see you next week.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Actually, we were going to talk about the minimally invasive devices that you have, because we were talking about why would people come to your office. So
Right.
what are some of the reasons, some of the devices or minimally invasive things that you can
procedures.
do?
Yeah, there are a number of them in ENT. It's one of the reasons why I think ENT can be fun. A lot of surgical subspecialties have this, and I think that minimally invasive things it's kind of a buzzword.
Yeah.
People hear it, they like the idea
Yeah,
of it.
it's
You're
like
not,
you light up.
yeah, you
Minimally
light up. You
invasive,
know,
I'm
oh,
in.
you know this. Yeah, exactly. And they're all over the place. In office, procedures in general are popular because of that. Folks don't want to undergo anesthesia. They want to see what they can do to get better in the office. The most famous ENT one, for example, is balloon dilations of the sinuses. You know, people know sinus surgery, and you know, you have to open up the sinuses to clear them out. We talked, you know, why people have that, but either way, you want to get in there, open it up, let people irrigate and get back to a healthy kind of nasal and sinus cavity. And so the first ones that probably came out, or at least that I can think of, are, you know, balloons. Get in there, instead of surgically opening it, dilate a balloon and recreate a natural outflow. And that was one of the big ones that we had for a long time. And now they're all over the place. You know, people are doing injections into vocal cords in the office.
What is that for?
So a lot of people are hoarse for some reason or
yeah.
another. We talked about thyroid surgery.
Yes.
Let's say the nerve had to be sacrificed or something happened, and now the vocal cord is not quite where it should be, and it needs to be moved over to give people quality of life and quality of voice. So you can literally inject some material to push it a little bit to give a stronger voice. We talked about nasal congestion. There's now these radio frequency devices that can open up the nasal cavity so that you know, you come in, you numb up the nose for 15 minutes, and then you're getting this procedure to shrink down the tissue to create a more open airway to breathe better.
Wow.
That is a very popular, newer one that's been used over the past 20 years, maybe.
I love that. So it's radio frequency
Yeah.
treatment. Is it multiple treatments, or you have to?
The answer is no.
Okay.
It's not meant to be. I mean, you have it sometimes where patients love it, and then it kind of fades over many years, and you'll see it again. But in general, these things are really meant to be done, a one-time thing. There's probably one of the most common complaints we get is drainage, chronic rhinitis, where you know, you always have a tissue in the hand, and you always have to.
Has that.
Yeah. And it's tough, and you try, like we talked about, you try all the medicines and nothing's working. So now the primary will send to the ENT, say, well, let's see what they, you know, and you make sure there's nothing else going on. And the first thing I think that came out was what's called cryoablation. You freeze this nerve in the back of the nose to prevent the drainage, and it worked really well. And now they have other ways of kind of ablating that nerve so that it doesn't create as much drainage in the nose. It's been a good time.
It's been an amazing time. I've learned so much. Was there any last call to action or anything you want to share with our audience before we leave in this last minute?
Look, you know, I'm an ENT. I'm biased. I think ENT is a wonderful field, and I think it's a field where there are a lot of things that we can do to improve patients' quality of life, to help patients that are suffering. And I think that if for whatever reason you're feeling, you know, maybe there's a step that you want to take or you need to take. Fortunately, there's a lot of us. Come find us. We'll help as much as we can, and I think that we offer probably things that that can really improve quality of life.
Well, we want to send them to you. Your number is 954-476-0400 in Plantation, Coral Springs, 954-796-0400. Please give Dr. Castle a call. Thank you so much, everybody, and have a great evening. We'll see you next week.
Thank you.
Thank
It's
you.
been a pleasure.